this space with unity, compassion, and understanding. We ask that our efforts, plans, and decisions align with what is best for our children's growth and well-being. Give us courage to advocate for those who cannot speak for themselves and the wisdom to recognize each one's unique needs. May this and all our endeavors be for their good and for your greater glory. Amen.
Thank you. On the part of the Committee on Health, do I hear a motion to dispense with the calling of the roll? Second. There's a duly seconded motion to dispense with the calling of the roll. Hearing no objection, the same is approved.
On the part of the committee, we dispense with the calling of the roll. Yeah. The dispensing of the rolling of the call is approved.
On the part of the Committee on Health, do I hear a motion to dispense with the reading of the previous minutes and the adoption of the same?
I so move, Mr. Chair. Second.
There's a duly seconded motion that we dispense with the reading of the minutes of the previous meeting and the adoption of the same. Hearing no objection, the same is approved.
On the part of the Committee on Welfare, the same is approved.
At this point, we'd like to acknowledge the presence of the Committee on Health members. Honorable Antolin Ureta of the Lone District of City of Malabon. Vice Chairperson, Honorable Marlesa Doc Marley Hoofer Hasim of the 2nd District of Zamboanga Sibugay. Honorable Juan Carlos Arjo C. Atayde of the 1st District of Quezon City. Honorable Henry Waminal Jr. of the Party List Ascenso Pinoy. Honorable Kenneth Paulo Tereng of the Party List KM Ngayon Na. Honorable Percy Sendanya of the Party List Akbayan. Honorable Janice Degamo of the 3rd District, Negros Oriental. Vice Chairperson, Honorable J.C. Raman Naval, Dr. Nava of the Lone District of Guimaras. Vice Chairperson, Honorable Milagros Aquino Magsaysay of the United Senior Citizens Party List. And Honorable Caroline Agyao of the Lone District of Kalinga. And Honorable Jerny Jet Nisay of Deputy Minority Leader, Honorable Jerny Jet Nisay of Party List Pusong Pinoy.
I would like to recognize the members of the Committee on Welfare of Children. May we welcome Representative Caroline Agyao of the Lone District of Kalinga. We have Representative Antolin Ureta of the Lone District of City of Malabon. And we also have Representative Marlesa Doc Marley Hoffer Hasim, 2nd District of Zamboanga Sibugay. Welcome.
Thank you. May we ask the COMSEC to acknowledge our resource persons this morning.
Good morning, Chair, honorable members of the committee. In attendance today for this meeting are the following. From the Department of Health, Ms. Rosemary Holandes, the Supervising Health Officer of the DPCB. Morning, ma'am. From the National Nutrition Council, Mr. John Daniel Gonzalez. Ms. Maria Lourdes A. Vega. From the Food and Drug Administration, Ms. Gladys Pascual. From the Council for the Welfare of Children, Mr. Sergio Serpicio Nepomuceno, Ms. Ina Alodia Santiago. From the Nutritionist Dietitian Association of the Philippines, Ms. Juvie Martilios C. From the Philippine Legislators Committee on Population and Development, Ms. Aurora Kilala. From the Healthy Philippines Alliance, Mr. Ralph Emerson de Golacion. From the Citizens Watch Philippines, Mr. Orlando Oxales. From the United Nations Children's Fund, or UNICEF, Ms. Alice Nukoroy. Did I correctly pronounce it? Are you here, ma'am, from the UNICEF? Good morning po. From the World Health Organization, Dr. Yu Lee Park. That would be all for now, Mr. Chair. Oh, I'm sorry. From the Imagine Law, Attorney Mikael Lawrence Milan.
Thank you, Comsec. Good morning, distinguished members of the Joint Committee, authors, and esteemed guests. Welcome to the joint meeting of the Committee on Health and Committee on Welfare and Children. The increase in overweight and obesity among Filipinos, especially Filipino children, is very alarming. According to the latest National Nutrition Survey, the prevalence of overweight and obesity among 5 to 10-year-olds increased from 5.7 in 2003 to 12.9% in 2023, and for adolescents 10 to 19 years old from 4.9 to 12.5%. Obesity among children has been found to have long-term effects, mainly in acquiring non-communicable diseases such as diabetes and hypertension. It's also worth to note that from 2023 to 2025, about 1/4 of children 0 to 5 years old suffer from chronic malnutrition, suffering from either undernutrition, micronutrient deficiencies, and obesity. Tunay na kailangan natin ang aksyon para matugunan natin ang matagal ng problema ng malnutrition, obesity or overweight, and of course the micronutrient deficiencies, so yung tinatawag na hidden hunger. In the interest of time, we'd like to inform that this first part of the committee meeting is a joint committee meeting with the Committee on Welfare of Children. We have up to 10:30, and then after this, we will tackle we'll have the regular Committee on Health meeting tackling on the hospital bills. So we'd like to appeal to our resource persons that you present your position briefly, and hopefully by 10:30 we'll be done with the bills on malnutrition, and also we'll have to listen to the Department of Health and National Nutrition Council on the Philippine Nutrient Profile Model. So I'd like to turn over the gavel to our co-chair, Chairman Singson.
Thank you, Chair Gato. Isang makabatang umaga sa aking mga kapwa mambabatas, mga kagalang-galang na panauhing pandangal, at sa lahat ng narito ngayong umaga. I welcome everyone to this joint session of the Committee on Health and the Committee on the Welfare of Children. The matters before us today concern child nutrition, the Philippine Nutrient Profile Model, and the broader question of how our food environment influences the health of the Filipino children. As chair of the Committee on the Welfare of Children, I believe we must always begin with a simple but important reality. Children do not choose their food environment. Adults create it. Many parents genuinely want to provide healthier food for their families. Yet they often face a marketplace where products are heavily marketed, Labeling can be confusing, and nutrition information is not always easy to understand. Bright packaging, advertising that targets children, and marketing strategies that emphasize taste, fun, or characters can strongly influence food preferences long before children understand what is healthy or not. At the same time, many families have limited access to clear nutrition education that would help them interpret food labels or understand the long-term health impact of certain dietary habits. This is why discussions on food labeling, responsible marketing, and clearer nutrition guidance are important. These policies are not meant to dictate what families should eat, but to ensure that parents and children are given fair, understandable information and are not unduly influenced by marketing practices that may undermine healthy choices. At the same time, we also recognize that the food industry plays an important role in our economy and food supply, and that concerns have been raised regarding regulatory approaches, implementation challenges, and the impact on business. It is therefore the responsibility of Congress to carefully examine the evidence, listen to all stakeholders, and find practical solutions that both protect children's health and remain reasonable for the sectors involved. Our objective today is not to assign blame to any sector. Rather, it is to better understand how we can create a food environment that supports healthier choices for Filipino families, especially for children who depend on the decisions that adults make around them. I hope today's discussion will help guide us towards policies that protect children, empower parents with clear information, and encourage responsible participation from all sectors involved. With that, I look forward to a constructive discussion, and thank you everyone for their participation.
Thank you. Before we proceed, we'd like to acknowledge the presence of a committee member, Honorable Eleanor Bulot Begtang of the Lone District of Apayao, Honorable Nathaniel Ojucado of the party list 1 Tahanan, and Honorable Nelson Ligacion of the 3rd District of Camarines Sur. May we now recognize the Department of Health, representative from the Department of Health, to brief us on the development.
Honorable Chairpersons, Your Honors, our colleagues and partners in health and nutrition. Good morning.
For a while.
Sorry.
May we now recognize the sponsorship of the resolutions, House Resolution number 466, House Resolution number 496, and House Resolution number 509. We now recognize Honorable Arjo Ataide for House Resolution 496.
Mr. Chair, Madam Chair, distinguished colleagues, our honored guests, magandang umaga po sa inyong lahat. Child malnutrition remains one of the most serious public health challenges facing our country. Behind every statistic is a child whose growth, cognitive development, and overall well-being may be compromised because of inadequate nutrition during the most critical years of life. When children suffer from malnutrition, the consequences extend far beyond health. It affects their ability to learn in school, limits their future productivity, and ultimately impacts the long-term development of our nation. Addressing this issue, therefore, requires not only health interventions, but also strong and coordinated policies. While government programs are already in place to respond to this challenge, it is important for Congress to carefully examine how these initiatives are being implemented and whether they are effectively reaching the communities that need them the most. Through this inquiry, we can identify gaps, strengthen existing efforts, and craft more responsive legislation. Mr. Chair, ensuring that Filipino children receive proper nutrition is a responsibility we all share. Through this resolution, we take an important step toward building stronger policies that will safeguard the health and the future of the next generation. Thank you, Mr. Chair.
Thank you, Honorable Ataide. Next is our co-chair, Honorable Richelle Singson, for House Resolution number 509.
Thank you, Mr. Chair. Given that my resolution is similar to our colleagues, in the interest of time, I request that the prefatory statement of my House Resolution number 509 be entered into the record as my sponsorship remarks. Thank you.
Thank you, Chair Richelle. For House Resolution number 466, Honorable Ataide will sponsor in behalf of the authors, Honorable Ferdinand Martin G. Romualdez, Honorable Yeda Marie K. Romualdez, and Honorable Jude A. Asidre.
Mr. Chair, on behalf of Representative Ferdinand Martin G. Romualdez, Representative Yeda Marie K. Romualdez, and Representative Jude A. Asidre, I move for sponsorship of House Resolution number 466 entitled "A Resolution Requesting the Committee on Health to conduct a congressional inquiry in aid of legislation into the current state of child malnutrition in the Philippines and the actions of the Department of Health through the National Nutrition Council and other concerned agencies in ensuring the mitigation of overall malnutrition situation in the Philippines." I so move, Mr. Chair.
Thank you, Honorable Ataide. Okay. Thank you. We now recognize from the Department of Health, Ms. Rosemary Holandes.
Honorable Chairpersons, Your Honors, and our partners here.
You're from the National Nutrition.
Yes, sir. I'm
Okay.
JD Gonzalez po. DOH will defer the presentation po of the Philippine Nutrient Profile Model. By the way of background, the formulation of the Philippine Nutrient Profile Model was initiated by the National Nutrition Council in partnership with World Health Organization Philippines, which commissioned the Nutrition Foundation of the Philippines to undertake the technical work for its development. This collaboration brings together national policy leadership, international expertise, and local technical capacity to ensure that the model is both evidence-based and context-appropriate for the Filipino population. Here with us today, Ms. Maria Lourdes Vega, consultant from the Nutrition Foundation of the Philippines, who has been directly involved in the development of the model. With the permission of the chairpersons, Ms. Vega will present to the Honorable Committee the 2025 Philippine Nutrient Profile Model. Thank you.
Good morning, honorable chairs and members of the Committees on Health and Welfare of Children. As mentioned, we will be presenting the Philippine Nutrient Profile Model that is being proposed, what was developed for the Philippines for various policy applications. As a backgrounder, nutrition profiling is a science of classifying or ranking foods based on their nutritional composition to prevent disease and promote health. At the forefront of efforts on nutrient profiling is the World Health Organization, and globally, regional centers of the WHO have developed their respective nutrient profile models for countries to consider in developing their own nutrient profile models. For example, the Philippines is part of the Western Pacific Regional Office, and we have here our representative for the Philippines, and it has the nutrient profile model for WIPRO, the way that there is a model for the Americas, Europe, and the other Southeast Asia and the other regions in the world. The Philippine nutrient profile model was developed to classify foods according to their nutritional composition that could affect to prevent obesity and non-communicable diseases, primarily diabetes, hypertension, and such, and overall to promote health. The nutrient profile model is a tool to guide policymakers in making decisions on policies related to regulating food marketing to children, front-of-pack labeling, as well as in food taxation of selected foods. The overall intent is to help promote a healthier food environment, which, as was noted earlier, children cannot make choices if the choices are not good in their environment. Well, this was noted earlier, increasing rates of obesity, which has been really concerning because the numbers are high for adults, relatively low for children, but they're climbing. And if nothing is done early, it's going to just increase. So the nutrient profile model, to clarify, is intended to be used by policymakers, food manufacturers, maybe the academe, but not directly for consumers, not directly to the general public, and the use of the public is through the policy application. The Philippine Nutrient Model uses what we call a category-based profile system, which means we consider all the food groups in the Codex Food Classification System. For example, there's a group for dairy, there's a group for fruits, there's a group for vegetables, and under each group there's a subgroup. The nutrients of concern that were chosen are those that have been identified to be closely linked with the obesity and non-communicable diseases. So specifically, we're talking about total fats, total saturated fats, total sugars, trans fatty acids, sodium, and non-sugar sweeteners. The numbers that you see are the thresholds that have been used in developing the nutrient profile model. What does so, for example, for total fat, anything that is greater than or equal to 30% of energy will exceed the threshold and down the line. So for saturated fat, the threshold is 10%, less than 10%. Total sugar, less than 10%. Trans fat, not industrial, sorry. Let me correct that. Trans fatty acids, it's 1% of energy, and there should be no partially hydrogenated oil in the ingredients. Sodium, we use a 1 milligram per calorie ratio, and there should be no non-sugar sweeteners. In determining the specific thresholds for each food group, we chose a reference food, a reference food for each food category. The reference food could either be a standard, a food considered as standard. So, for example, for dairy milk, cow's milk was used as a reference food. We got the energy values from the food composition table of the Philippines. If not available, we use the USDA food base, but I think it was only for 1 or 2 products. Or we used labels of commercially available products. With the having a reference value is important. Energy value is important because that's where the percentage thresholds are applied. The Philippine Nutrient Profile Model will not profile infant and follow-on formulas, complementary food for children 6 to 35 months old, primarily because there's another policy that covers the implementation of the concerns related to infant and young child feeding. Food, as well as food for special medical purpose, because there's another policy cover for this, and culinary ingredients like salt, sugar, and flour, because they are profiled when they become part of the food item that is being reviewed. And nutrient profiling will apply to prepackaged processed foods because they're the ones that have nutrition labels and therefore nutrition information. To give you an idea of how the nutrient profile model looks like, it is a table that lists down all the food groups. This is just one page, one category of foods. There are several food categories, I think 12 or 14 of them. Then these are the values for total fat, saturated fat, trans fat, total sugars, added sugars, sodium, and non-sugar sweeteners. The numbers here represent grams. So, for example, for fluid milks should have such total fat of less than 2 grams, or saturated fat of less than 1 gram. There's no threshold for total sugars, but fluid milks should not have added sugars. And the added sugars can be determined from the ingredient list. Now, all these values are based on 65 calorie food item that is cow's milk that was chosen because it is considered a standard for milk. So this is how the nutrient profile model looks like. To use it, the food product, 100 grams of nutrition information of 100 grams of that food product is determined and compared with the threshold. So if, let's say, there is a there's some fluid milk in the market that includes sugar in its ingredient list, that would be considered as exceeding the threshold. Now, so there are different thresholds for each food group. If you want, we can go over it, but this is just to give you an example of how it would look like. So that is the Philippine Nutrient Profile Model. Again, let me repeat, it is a tool that should help. I will stop here na lang. Can you go back to the table? There, next steps. Let me just summarize that the nutrient profile model is a tool that will help identify food products that exceed levels for certain nutrients. Well, there's a part of the presentation that shows how our food supply looks like. Do you want me to go over it? Because I thought maybe this would be enough.
Maybe you can just submit your to this committee.
Okay, so for the next steps, the nutrient profile model will be subjected to formal review, approval by the NNC Governing Board, and it will be used for adoption of related policies related to food marketing to children, related to front-of-pack labeling, food taxation, and others, as may be decided on by agencies like the SWD and the Department of Education. Monitoring and evaluation of the tool will be happening in the next years, and after 5 years, or as more scientific information is available, then we are going to review and revise it accordingly. I think that's all, Mr. Chair, to the honorable chairs and members, unless you have questions.
So, in other words, ma'am, we do not have yet the Philippine Nutrition Profile
It's
model.
almost there.
But wala pa.
Almost March 18 yung...
The current status, Mr. Chair, of the Philippine Nutrient Profile Model, it is currently approved by the NNC Technical Committee, and it will be one of the agenda for the NNC Governing Board this March 18 po.
So do you have a timetable when do we expect this Philippine Nutrition Profile Model to be finished?
If this will be approved po by the NNC governing board, then we can proceed po with the next steps
Because
for
this
the
is a very important,
Yes,
because
Mr.
it
Chair.
will be a basis in consolidating the different bills on nutrition.
Yes, Mr.
We need to have these Philippine
Nutrient profile model.
nutrient profile model.
Yes, Mr. Chair.
Okay.
Thank you.
So when is this?
The NNC governing board is on March 18, Mr. Chair.
So do we expect this to be done by the first quarter?
Yes,
this year?
Mr. Chair.
Okay. Thank you.
Mr. Chair, before we continue, may I acknowledge some of my members? I'd like to acknowledge Representative Roman Romulo from the Lone District of Pasig, as well as Representative Audrey K. Zubiri from the 3rd District of Bukidnon, and Representative Siti Amina Dimaporo from the 2nd District of Lanao del Norte. Welcome.
Thank you, Chair. Also, we'd like to recognize the presence of the Chairman of the Committee on Basic Education, Honorable Romanti Romulo of the Lone District of City of Pasig, Honorable Audrey K. Zubiri of the 3rd District of Bukidnon, and Honorable Siti Amina Dimaporo of the 2nd District of Lanao del Norte. From the Department of Health, Representative.
Okay. Good morning, Mr. Chairperson and honorable members of the committee and colleagues in government and non-government agencies. The Department of Health expresses its appreciation to the committee for the opportunity to participate in today's initial deliberation on the proposed measures addressing child malnutrition and the adoption of the Philippine Nutrient Profile Model. The DOH recognizes child malnutrition as a continuing public health concern that affects the growth, development, and overall well-being of the Filipino children. In this regard, the Department supports policy initiatives that strengthen evidence-based nutrition interventions and promote healthier food choices among the population. The establishment of science-based tools, such as the Philippine Nutrient Profile Model, is an important step in guiding nutrition policies and regulatory measures aimed at improving the nutrition situation in the country. In this regard, the Department of Health expresses its general support for the intent of the proposed measures. The DOH will likewise submit its official position paper to the committee once the same has been duly signed by the Secretary of Health. Thank you po.
Thank you. Ms. Holandes?
Yes, sir.
At this point, we'd like also to acknowledge the presence of our Vice Chair, Honorable Giselle Mary Maceda of the 4th District of City of Manila. We now proceed with the sponsorship of the bills on healthy food marketing. We will tackle the sponsorship of all the 29 bills before we recognize our resource persons. So first on the list, we now recognize Honorable Antolin Oreta of House Bill number 6147, an act protecting children from unhealthy food marketing and providing penalties for its violation and for other purposes. Honorable Oreta is now recognized.
Mr. Chair, Madam Chair, distinguished colleagues, good morning. I also would like to acknowledge Ma'am Net Oliveros, former BNS of Malabon City. It is my honor today to sponsor House Bill 6147, which seeks to address childhood obesity, a growing crisis that is not simply in our imagination. It is not an imagination that only last week, March 4, we commemorated World Obesity Day to put a spotlight on over 1 billion people living with obesity today. Over 400 million of this number are children and adolescents, according to the World Obesity Federation. And as just presented by the National Nutrition Council, it is not our imagination that the Philippines is facing a triple whammy of malnutrition, the country does not only have undernutrition and micronutrient deficiencies issues, but sadly experiences the increasing trend in overweight and obesity of adults and children. 1 in 10 Filipino children aged 5 to 10 years old and adolescents aged 10 to 19 years old are considered overweight according to the latest National Nutrition Survey. And more than 30% of adolescents will be classified as overweight and obese by 2030 if there is no intervention to prevent these. Overweight and obesity increase the risk for non-communicable diseases like diabetes and heart conditions. Poor nutrition and physical inactivity are major contributors to overweight and obesity. An unhealthy food environment where prepackaged food and beverage products high in sugar, salt, and fat are easily accessible, convenient, and cheaper is a key driver to unhealthy diets. The aggressive marketing of unhealthy prepackaged foods and lack of clear and accessible nutrition information are characteristics of this food environment. Obesity is no longer just a personal health issue. It is a growing public concern that affects Filipino families across all ages, income levels, and communities. From children's relentless exposure to marketing of unhealthy prepackaged food and consuming high-processed snacks to adults unknowingly exceeding daily sugar, salt, and fat intake, the problem often begins not with choice, but with lack of clear information. This is where House Bill 6147, or I fondly call as TALK, Tamang Alaga, Tamang Kinabukasan, comes in. The proposed measure recognizes the urgency of restricting exposure of our children to marketing of unhealthy food, but it also champions one simple but powerful idea: malinaw na label, mas malusog na pamilya. Food labels are meant to guide consumers, yet many are cluttered with technical terms, fine print, or misleading claims that make it difficult for ordinary Filipinos to understand what they are really eating. When labels are unclear, families, especially parents buying food for their children, are left guessing. TALK seeks to address this gap by promoting clear, easy-to-understand food labeling that empowers consumers to make informed choices. By highlighting essential nutritional information in a more visible and understandable way on the front of packaged nutrition label, the measure aims to help prevent diet-related diseases, including obesity, diabetes, and heart conditions. This approach does not restrict choice nor burden consumers. Instead, it respects the Filipino family's right to know. When people understand what is in their food, they are more likely to choose better. Not because they are forced to, but because they are informed. At its core, TALK is about alaga, care for our children to reduce their exposure to unhealthy food marketing, and care for our parents and our communities. TALK recognizes the long-term health begins with small everyday decisions made at the grocery shelf, the sari-sari store, or the school canteen. A healthier nation starts with informed families. A stronger future begins with transparency today. TALK reminds us that protecting our people, our children, does not always require complicated solutions. Sometimes it starts with reducing exposure of our children to unhealthy food marketing. Sometimes it starts with something as simple and as powerful as a clear front of packaged nutrition label. Mr. Chair, distinguished colleagues, we are the solution. Let us play our role to vote for this passage of the proposed measure. Maraming salamat.
Thank you, Honorable Oreta. We now move to House Bill number 7777, an act protecting children from unhealthy food marketing and providing penalties for its violation and for other purposes, by Honorable Juan Carlos Ataide. Honorable Ataide is now recognized.
Mr. Chair, distinguished colleagues, honored guests, good morning po. House Bill number 777 is a measure that seeks to protect Filipino children from aggressive marketing of unhealthy food and beverages. Today, our children grow up in an environment where advertisements constantly shape their preferences, from television to digital platforms, often promoting products that may not support their long-term health. Research has shown that children are particularly vulnerable to marketing strategies that influence what they want to eat and drink. When unhealthy options are repeatedly presented as appealing and exciting, it becomes much harder for children and even their families to make healthier choices. Over time, these influences contribute to poor dietary habits that can lead to serious health concerns. Across the world, many countries have already begun strengthening policies to protect children from the harmful effects of aggressive food marketing. And as legislators, we also have the responsibility to ensure that our policies help create an environment where children are encouraged to make healthier choices. This bill is about creating that healthier environment. It recognizes that while business play an important role in our economy, the well-being of our children must remain a priority in the policies we shape. Dear colleagues, protecting children's health today means securing a healthier nation. For this reason, I respectfully seek the support for the approval of this measure. Thank you, Mr. Chair.
Thank you, Honorable Ataide. Next is House Bill number 6834, an act creating a healthy food environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children by Honorables Percival Sendanya, Honorable Jose Manuel Tadeo Diokno, Honorable Dada Kiram Ismula, and Honorable Kaka Bagao. Honorable Sendanya is now recognized.
Maraming salamat, Mr. Chair. Mr. Chair, Madam Chair, my dear colleagues, magandang umaga po sa ating lahat. Sino po sa atin dito ang in a relationship? Pataas naman po ang kamay. In a relationship. Pati po resource persons required po. Ayan, in a relationship. Who among us here is in a relationship? Ayan.
Relationship with even those who are not around anymore.
Yes. Alam po natin na bilang tayo ay in a relationship, sa relasyon ayaw natin sa red flag. Ayaw natin sa sinungaling. Ayaw natin sa insincere. At higit sa lahat, ayaw natin sa toxic. Ganito rin tayo pagdating sa pagkain. Ayaw natin sa mali-maling nutritional facts. Ayaw natin sa false advertising. At ayaw natin sa makasasama sa ating kalusugan. Kaya gaya sa love, ang pagkain dapat may label din. Para alam natin kung carry pa o major red flag na. This is why Akbayan Party List filed the Healthy Food Environment Bill. Dapat markahan ng red flag at lagyan ng font of package warning labels ang mga pagkaing high in sugar, high in sodium, high in saturated fat, high in total fat, at high in calories. Lalong-lalo na ang mga instant noodles, instant meals, at instant beverages, na ang ending, instant din ang binibigay na sakit sa mga kababayan natin. Ang tatay ko po ay may chronic kidney disease na eventually yun ang kinamatay niya. At alam po yan ng mga pamilya na mga may CKD na kinakailangang mag-dialysis twice or thrice a week. Pag sa dialysis po, meron sila mga tinatawag na classmate. Kasi di po ba per session yan? At yung tatay ko po, ang kanyang classmate sa kanyang dialysis sessions, 3 bata. Isang 10, isang 8, at isang 12. At pag tininan po natin, anong dahilan, bakit sila naroon? Dahil po sa kinakain nila. While many are saying that children choose what they eat because kids can tell, sa totoo lamang po, they can't. Kasi tulad po ng mga adults na dadala tayo sa advertising, pero mas vulnerable sila. Kaya napakahalaga po nitong ating panukalang batas. Deserve po nating lahat ang healthy, both sa relationships at sa pagkain. Akbayan urges this committee to approve House Bill 6834 or the Healthy Food Environment Bill. Sabi nga po natin, pag mahal mo, ilayo mo sa toxic. Pag mahal mo, protektahan mo sa red flag. Pag mahal mo, akbayan mo. Akbayan po natin ang isang healthy food environment. Marami pong salamat.
Thank you. Agree. Honorable Sendanya for the very relatable sponsorship speech. Before we proceed, we'd like to acknowledge the committee member, Honorable Iris Marie de Mesa Montes of Party List 4K, Honorable Wilfredo Arman de Maguila Jr. of the Lone and Vice Chairperson from the Lone District of City of Binyan, Honorable King George Leandro Antonio Colliantes of the 3rd District of Batangas, Honorable Maria Victoria Copilar of the 6th District, Quezon City, and Honorable Jane T. Castro of the 2nd District of Capiz. Next is House Bill number 6097, an act to create a healthy food environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children, by Honorable Janice Degamo. Honorable Degamo is now recognized.
Thank you, Mr. Chair. Good morning sa lahat. The introductory note of fellow representative from Akbayan Party List, Representative Sendena, said it all. It was so simplified and was so vividly explained that in my belief there is no need to add another another explanatory note because he have said it all already. So therefore may I manifest that the explanatory note of House Bill 6097 entitled An Act to Create a Healthy Food Environment for Food High in Sodium, fat or sugar, and regulating the marketing of such food to children will be the sponsorship speech of this said House Bill. Thank you, Mr. Chair.
Thank you, Honorable Degamo. Next is House Bill number 6507, an act to create a healthy food environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children, by Honorable Romanti Romulo. Honorable Romulo is
Mr. Chair, in the interest of time, my bill itself with its explanatory note will serve as its sponsorship remark. Thank you, Mr. Chair.
Thank you, Honorable Romulo. Next is House Bill number 8284, an act promoting healthy diets through front-of-package warning labels and comprehensive marketing restrictions on unhealthy food and beverages, by Honorable Jernijet Nisay. Honorable Nisay is now recognized.
To the Honorable Chairpersons of the Joint Committee on Health and Committee on Welfare of Children, colleagues, and esteemed guests, a blessed Wednesday to us all. I seek your support today for House Bill number 8284, or the Health Food Marketing and Labeling Act. Mr. Chair and Madam Chair, sa kasamaang palad, ang pusong Pinoy ng ating mga kababayan ay naharap na sa lumalaking banta mula sa sakit sa puso, diabetes, cancer, at iba pang non-communicable diseases na malaki ang kaugnayan sa ating mga pagkain. Sa Pilipinas, ang mga NCDs ay kabilang na sa pangunahing sanhi ng maiwasang pagkamatay. Maraming pag-aaral ang nagpapakita ng mataas na konsumo ng ultra-processed foods ay nagdudulot ng mas mataas na panganib ng obesity, sakit sa puso, cancer at iba pang malubhang karamdaman. Sa katunayan, ayon sa pinakahuling datos ng National Nutrition Council, tinatayang 70% ng populasyon sa NCR ay overweight o obese, na nagpapakita kung gaano kalaki ang hamon sa nutrisyon at kalusugan sa ating bansa. Bilang tugon dito, layunin ng ating panukalang Healthy Food Marketing and Labeling na bigyan ng kapangyarihan ang mga mamimiling Pilipino sa pamamagitan ng mandatory front-of-package warning labels. Ang malinaw at simpleng babalang ito na ginagamit na sa mga bansang tulad ng Chile, Mexico at Canada ay tumutulong sa mga pamilya na madaling matukoy kung ang isang pagkain ay may mataas na asukal, asin o unhealthy fats. Kasama rin sa panukala ang paggamit ng Nutrient Profile Model, isang science-based tool na ginagamit sa buong mundo upang matukoy kung kailan labis na ang mga nutrients o concern sa isang produkto. Sa ganitong paraan, ang ating regulasyon sa labeling and marketing ay mananatiling nakabatay sa agham at sa layuning maiwasan ang sakit. Mahalaga rin na patatagin ang kakayahan ng Food and Drug Administration at ng Department of Health upang maipatupad ng maayos ang mga regulasyon ito at maprotektahan ang mga mamimili, lalo ng ating mga kabataan mula sa mapanlinlang na marketing ng pagkain. Sa pinakapuso nito, Simple lamang ang layunin ng panukalang ito, maiwasan ng sakit bago pa ito magsimula, at bigyan ng mga pamilyang Pilipino ng malinaw na impormasyon upang makapili ng mas masustansyang pagkain. Kaya naman hinihiling ko ang suporta ng komite na may sulong ang panukala upang masigurong malinaw ang babala sa mga pagkaing hindi masustansya at mas protektahan ang kalusugan ng pusong Pinoy at pamilyang Pilipino. Maraming salamat po, Mr. Chair, Madam Chair.
Thank you, Honorable Nisay. Next is House Bill number 6166, an act to create a healthy food environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar and regulating the marketing of such food to children by Honorable Dr. Giselle Mary Maceda. Honorable Maceda is now recognized.
Magandang umaga, Mr. Chair, fellow representatives at sa lahat ng ating iginagalang na mga eksperto. Ang mga hindi nakakahawang sakit tulad ng cancer, diabetes at sakit na may kinalaman sa paghinga at puso ay nagsisilbing sanhi ng 68% ng lahat ng pagkamatay sa ating bansa. Ang obesity ay isang malakas na indikasyon at sanhi ng mga sakit na ito. Matanda man o bata, umabot na halos 7% increase ng obesity sa populasyon natin mula taong 2003 to 2023. Ang isa sa mga maituturing contributor sa problemang ito ay ang pagkaing pag-inom ng mga produktong mataas sa fats, sodium or sugar. Mas lumalala pa ang problema dahil sa napakadaling pagkuha ng mga produktong ito at napaka-agresibo pa sa pagbenta. Bigyan natin ang ating mga kapwa Pilipino ng oportunidad na suriin at alamin ang totoong nilalaman ng pagkain at inumin na binibili nila. Bigyan natin ang mga mamamayan ng pagkakataon na makagawa ng mas malusog na desisyon at desisyong may kaalaman. Sa batas na ito ay makakahakbang tayo tungo sa mas mulat na mamamayan at mas malusog na Pilipinas. Dahil dito umaasa kaming sa inyong mga suporta sa pagpasa ng Healthy Food Environment Act. Maraming salamat, Mr. Chair.
Thank you, Honorable Maceda. Next is House Bill number 7119, an act creating a healthy food environment requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children by Honorable Iris Montes. Honorable Montes is now recognized.
Thank you, Mr. Chair. Magandang umaga po sa ating lahat. In the interest of time, may I manifest that the explanatory note of House Bill 7119 be considered as my sponsorship speech. Let me just state, however, Mr. Chair, that we owe our children a future where health is not a gamble but a guarantee. By requiring clear front-of-pack warnings on foods high in sugar, saturated fat, and sodium, we give parents the truth they need, protect young bodies and minds from lifelong harm, and reshape the marketplace so that healthier choices become the easy choices. This bill is an investment in our next generation. Thank you, Mr. Chair.
Thank you, Honorable Montes. Before we proceed, we'd like to acknowledge our Vice Chairperson, Honorable Julius Cesar J. Vergara of the 3rd District of Nueva Ecija. Next is House Bill number 6506, an act to create healthy food marketing environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children by Honorable Jane Castro.
Thank you, Mr. Chair, and good morning, everyone. So Mr. Chair, I move that the explanatory note for House Bill number 6506 be my sponsorship speech. And also, I would like to add that taking care of our children's health while they are young would allow them to mature into productive individuals who could contribute to the development of our society. A healthy child also saves families from the financial burden of paying for costly maintenance, medicines, laboratories, and other healthcare-related expenses. Thank you, Mr. Chair.
Thank you, Honorable Castro. Next is House Bill number 7687, An act to create healthy food environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children by Honorable King Colliantes.
I manifest that my explanatory note for House Bill 7687 be considered as my sponsorship speech. But Mr. Chairman, may I also include that prevention will help the children by allowing them better choices, it will give them the ability to take care of their health and include it as part of their routine in their daily lives, which will result in a healthier populace, thereby lessening the need for government to shoulder medical expenses in the future for our people. Thank you, Mr. Chairman. Thank you, Madam Chair.
Thank you, Honorable Colliantes. Next is House Bill number 6932, an act to create a healthy food environment by requiring front-of-package warning labels for food high in fat, sodium, or sugar, and regulating the marketing of such food to children by Honorable Julius Cesar J. Vergara. Honorable Vergara is now recognized.
Thank you, Mr. Chair. My goodness. I rise today to sponsor House Bill number 6932, a measure that seeks to create a healthier food environment for every Filipino, particularly for our children, by requiring front-of-package warning for food products that are high in fat, sodium, or sugar, and by regulating the marketing of such products to children. Mr. Chair, hindi na po natin maikakaila ang lumalaking problema ng non-communicable diseases sa ating bansa. Mga sakit tulad ng diabetes, sa puso, cancer, na ngayon ay bumubuo ng malaking porsyento ng mga namamatay sa ating mga kababayan. Isa sa mga pangunahing risk factor ay unhealthy diets, particularly the excessive consumption of highly processed foods that are high in salt, sugar, and unhealthy fats. More alarming is that this trend is now affecting our children and adolescents. Studies show that the prevalence of overweight and obesity among Filipino youth continues to increase, placing them at a greater risk of developing serious health conditions later in life. Mr. Chair, one of the biggest challenges consumers face today is lack of clear and accessible information. Madalas ang nutrition information ay nakasulat sa likod ng packaging. Maliliit ang font at mahirap maintindihan ng ordinaryong mamimili. Ang resulta, maraming Pilipino ang hindi naintindihan o nalalaman kung ano yung kanilang kinakain. This bill addresses that gap. Through front-of-package warning labels, consumers will immediately see if a product is high in sugar, salt, or fat. Simple, visible, and easy-to-understand labels will empower ang mga ordinaryong mamimili. As a result, many Filipinos will be more informed on the healthier choices when buying food. Equally important, this bill also seeks to protect children from aggressive marketing of unhealthy food products. Alam po natin ang mga bata ay madaling ma-impluwensyahan ng advertising, whether through digital platforms, TV, or promotions in places where children frequently go. By regulating these marketing practices, we aim to reduce children's exposure to unhealthy food advertising. This measure is not about restricting choice. It ensures that consumers are properly informed and that our children are protected from harmful food environments. So napakaraming bansa po ang gumagawa na nito. Ultimately, this bill aligns with our constitutional duty to protect and promote the right to health of the Filipino people and to ensure that every child has the opportunity to grow up in an environment that supports proper nutrition and healthy living. Distinguished colleagues, Mr. Chair, the health of our people, especially our children, is a responsibility we all share. By passing this measure, we take an important step toward building a healthier Philippines for present and future generations. In this light, I respectfully seek the support of this committee for the approval of the said bill. Maraming salamat po.
Thank you, Honorable Vergara. The following House bill, the authors are not present, so in their behalf, we will recognize Honorable Hoofer Hasim to sponsor in their behalf. House Bill number 130, House Bill number 560, House Bill 819, House Bill 2541, House Bill 2660, House Bill 5553, House Bill 6050, House Bill 6065, House Bill 6097, House Bill 6333, House Bill 6392, House Bill 6625, House Bill 6806, House Bill 7409, House Bill 7756, House Bill 8228, House Bill 8232, House Bill 8245, and House Bill 8290. Honorable Hoofer Hasim is now recognized.
Thank you, Mr. Chair. In behalf of all the authors of the 18 House bills, may I move that the respective explanatory notes be adopted as their sponsorship speech. Thank you.
Thank you, Honorable Hoofer Hasim. At this point, recognize resource person from the Food and Drug Administration, Ms. Gladys Pascual, the Food and Drug Regulation Officer 3.
Good morning, Mr. Chair, and to all the members of the committee and to everyone. So the Food and Drug Administration expresses its strong support for the objectives of the proposed House bills, which seek to promote healthier dietary behaviors and reduce the burden of non-communicable diseases among the Filipinos. The FDA recognizes that excessive consumption of foods which are high in sugar, sodium, and unhealthy fats significantly contributes to the increasing prevalence of the cardiovascular diseases and other NCDs in the country. Creating a healthier food environment through a clear labeling and responsible marketing regulations is therefore a critical public health intervention. The FDA recommends that the proposed regulatory measures be evidence-based, scientifically sound, and feasible for enforcement and be supported by reasonable transition mechanism to assist the affected industries in complying with the new requirements. Policies should promote improved public health outcomes while still preserving the local food production and ensuring continued consumer access to safe, nutritious, and affordable food products. Further, the FDA underscores the importance of clearly defining institutional roles to ensure efficient enforcement and avoid any regulatory overlap. In view of the foregoing, we have several minor comments that we will going to submit to the committee secretary. Thank you.
Thank you. From the Nutritionist Dietitian Association of the Philippines, or NDAP, Ms. Juvie Martilius C.
Good morning, Mr. Chair and honorables and distinguished colleagues. I am as well representing our Dr. Cecilia Gan, Executive Director of Philippine Children's Medical Center. So our position statement on the healthy food environment marketing bills, we respectfully express our strong support for the proposed healthy food marketing environment bills aimed at establishing a healthier food environment for Filipinos, particularly children and adolescents. This proposed policy represents an important step toward addressing the growing burden of diet-related diseases and improving nutrition outcomes in the country. Several studies in the Philippines have reported increasing prevalence of childhood and adolescent obesity using data from the expanded National Nutrition Survey. Desnacido et al. 2022 found that 12% of Filipino adolescents were overweight or obese, with higher risk among those living in urban areas and consuming excess energy intake. Environmental factors also contribute to obesity, as school environments may promote unhealthy dietary patterns and sedentary behaviors, as stated by Kakatian et al. 2025. Additionally, dietary habits as frequent consumption of fast foods and snacks have been associated with higher obesity prevalence among Filipino children, as stated as well by Barrios 2019. The global experience shows industry self-regulation is limited. Marketing shifts to digital platforms as well as children remain heavily exposed. It is also stated by the UNICEF, in a digital world, our dual challenge is how to mitigate the harms while maximizing the benefits of the internet for every child. Thus, the Philippines continues to face a double burden of malnutrition, where undernutrition persists, while overweight and obesity are steadily increasing, especially among school-age children and adolescents. The widespread availability, affordability, and marketing of foods and beverages high in sugar, salt, and unhealthy fats contribute significantly to unhealthy dietary patterns. Children are particularly vulnerable to these influences, which shape food preferences and consumption behaviors from an early age. Thus, there are arising nutrition-related health risks, increasing rates of childhood obesity, as mentioned, based on evidences, early risk factors for type 2 diabetes, growing prevalence of hypertension as well, and diet patterns shaped early in life. The proposed Healthy Food Environment House bills seek to address these concerns by promoting policies that support healthier dietary choices and protect children from harmful food environments. I would like to express also to share important elements of an effective policy. There should be a clear nutrient profiling system, restrictions on marketing directed at children, protection of school environments, which we see the best place to dosage children with right nutrition information, monitoring and enforcement mechanisms. If we could give time enough to review plantillas in the LGUs, in designating a competent registered nutritionist dietitians, in the execution of these initiatives in the local government units. Key provisions of the measure include strengthening regulations on the marketing of unhealthy food and beverages to children, improving nutrient labeling in the simplest way to understand in a easy access of the consumers, to make them easy decision what to choose, and promoting healthier food environments in schools and communities. Thus, on behalf of NDAP, the Nutritionist Dietitians Association of the Philippines, and the Philippine Children's Medical Center, we strongly recommend that the enactment of the Healthy Food Environment House Bills or Act will significantly contribute to national efforts to improve nutrition, reduce the risk of non-communicable diseases, and safeguard the health of future generations. Thank you and good morning.
Yes, Honorable Romulo.
Yeah, Mr. Chair, would it be possible just to clarify from NDAP certain of the statements they made? Yes, para sa ating NDAP, ma'am, kasi sa comments po ninyo, you mentioned both obesity and undernutrition. Do you have any data on which is worse? Anong ages ang meron yan? Because para alam rin namin kung ano yung where you are coming from.
Yeah, thank you for having this attention, Honorable. Because I am a nutritionist dietitian in the hospital. The percentage is higher in undernutrition.
Yes, would you have the absolute numbers and from what ages to what ages? Because that would also help us when the bills will be consolidated to be able to come up with a better version of all the bills.
Yes, so we can get a specific data with the help of WHO and UNICEF because we are still busy with the numbers, also with the FNRI studies to be specific, sir. We can give it later. But I am confident that the percentage is higher from the undernourished from the age of infants up to the toddler from 0 to 5 years of age or below 5 years of age.
So below 5 years old, ang problema natin is undernutrition.
Yes, sir.
Pagdating ng school age, the challenge now is more of obesity rather than undernutrition?
Yes, sir, because it's almost both, but the exposure of the 5 years and above.
Sige. Ma'am, okay naman sa akin, as long as you will, as you mentioned, you will submit to this committee the percentages and yung basis po ninyo for that.
Yes,
and
sir.
last na po, Mr. Chair, last question to end up. Ma'am, you're a nutritionist?
Yes, sir.
Yes, how many nutritionists do we have in the whole Philippines?
It's like 10 to 12,000 by the record in PRC.
10 to 12,000.
Yes,
and
sir.
of the 10 to 12,000, are all actively nutritionists or have others from the 10 to 12,000 already chosen another career path?
Yes, sir. R&Ds or registered nutritionist dietitians, we have different fields. They are assigned in public health nutrition, in the community. We are also in the hospital, as well as in the food service and business industry.
Yes,
so we are in a different
kalat-kalat.
Opo.
Yes, and one of your recommendations was really for the LGUs to be able to have a registered nutritionist. But how many LGUs do we have in the whole Philippines? And then there are only 10 to 12,000 nutritionists. So I think one of the recommendations of the committee eventually should be to advise the CHED to be able to give more tulong-dunong programs for those who will become a nutritionist or dietitians. Kasi sabi yung recommendation kanina, dapat ay bawat LGU meron. Pero kung 10 to 12,000 lang, kalat-kalat pa yun, again, this is, it's going to be a Pyrrhic victory if we pass this. Wala naman mag-i-implement.
Thank you, Honorable Romulo. We now recognize from the Department of Trade and Industry, Attorney Mia Upendo.
Good morning, Mr. Chair. Good morning to everyone present here. I am from the Department of Trade and Industry, Fair Trade Enforcement Bureau. The Department of Trade and Industry, DTI, recognizes the growing threat of non-communicable diseases in the Philippines and supports the government efforts to promote consumer health and safety. The proposed FOPWL and marketing restrictions on products high in sugar, sodium, fats, and calories. As the agency mandates to promote consumer welfare and ensure fair trade practices, the DTI offers this position in alignment with its consumer protection and market development mandates. The DTI, of course, supports the objective of the Health, Food, Environment Act to protect consumers, particularly children, from deceptive marketing and harmful food products. However, while recognizing the importance of health-driven policy, the DTI emphasizes the needs for balanced, inclusive, and practical implementation that considers consumer rights, industry readiness, especially that of MSMEs, and market competitiveness. The DTI is aligned with the bill's policy direction of empowering consumers to make informed food choices. Mandating clear and simplified FOPWL is a progressive leap towards bridging the nutritional information gap, particularly among vulnerable sectors, consistent with Section 2 of the Consumer Act of the Philippines, or RA 7294. Such labeling policies and upholds consumer rights to information and protection from hazardous products. The proposed acts provide for differentiated penalties and recognize the unique challenges faced by MSMEs. However, the burden of compliance, such as redesignating packaging, managing warning labels, and navigating marketing restriction, could disappropriately affect smaller enterprises. The DTI acknowledges the increasing shift toward digital and e-commerce platform. The regulation of marketing practices on these platforms under Section 3 and 17 is timely. However, enforcement mechanism must be feasible, considering the borderless and algorithm-driven nature of online advertising. The DTI notes that the implementation of this act must align with fair trade practices and avoid unintentionally distorting market dynamics. Large enterprises may absorb compliance costs more easily, placing MSMEs at a bit of disadvantage. Additionally, imported and foreign goods must be held to the same standard to prevent unfair competition and ensure a level playing field for local businesses. Finally, the DTI underscores that the effectiveness of FOPLW and marketing restriction is contingent on public understanding and acceptance. Labeling alone may not sufficiently influence healthier food choices without parallel sustained consumer education and awareness efforts. In view of the foregoing, the DTI respectfully submits several inputs, recommendation to further improve the bill's implementation and ensure that its objectives are achieved without unintended adverse impact on consumers, businesses, and the broader economy. With that, thank you, and we hope for a helpful discussion on this matter. Thank you.
Thank you, Attorney Upendo. Before we proceed, I would like to acknowledge the presence of Deputy Majority Leader, Attorney Marlene Primicias Agabas, and Honorable Agatha Paula Aguilar Cruz of the 5th District of Bulacan. Yes, Honorable Romulo.
Mr. Chair, for the DTI, under the admin code, ano yung primary responsibility ng DTI?
Aligned with
Is it to protect consumers or to protect the industries? Yung talagang honest lang tayo, kasi I just want to understand what DTI's role is.
Yes, sir. Basically, DTI protects both. We have to
Correct.
balance. Of
You have to
course.
balance.
The
Pero may konting preference, of course, because you have to
Yes,
ensure na businesses
Yes, especially.
continue to thrive, di ba?
Yes, sir. Especially.
Yes. So, as you said earlier, assuming tama yung sinabi mo kanina kasi, kailangan talagang i-balance yun, di ba?
Yes.
Kasi, ang naapektuhan yung mga maliliit ba?
MSMEs, yes,
Small enterprises natin or medium and small, di ba? Yun ang naapektuhan. Do you have a study already assuming this happens? Sabi kanina ni Honorable Sendanya, if I correct, kung tama, mag-alala ko sabi niya, isang na-mention kasi yung instant noodles
Yes, sir.
So, katulad yan, sino ba talaga nagko-consume yan? Do you already have a study on that? Para alam natin, when this committee consolidates and decides on the substance of the consolidated version, at least magandang contribution yun from DTI.
Yes, sir.
Ano yung effect niya? Sino yung maapektuhan? SMEs lang ba? Or merong malalaki? At sino ba yung market na talagang matatamaan nun?
First of all, sir, of course, we are, especially under RA 1794, consumer po talaga ang ating pinoproteksyonan. So, above everyone else, it's the consumer which is the main priority of the law. But as we have mentioned, sir, we mentioned MSMEs because there is requirements of documentary list po doon sa proposed bill. Of course, bigger companies, especially noodles.
Yes, we understand. You will be able to respond generally.
Yes,
ang
sir.
kailangan namin yung numbers.
Yes, sir. We will take note of that, sir, because as of now, sir, wala po kaming data dun po sa kailangan ninyo. But
Yes.
rest assured po that
Yes.
as we
But back
submit
in the
our
office,
comment,
meron
we will
po.
include it. Yes, sir.
Yes, so you will submit that to this committee
Yes, sir.
kung sino yung kung ano yung industry na tatamaan, whether small SME or whether malaking industry, at sino yung primary na consumer ng mga talagang malalagyan ng markings.
Duly noted, sir.
Yes, thank you.
No
Yeah.
worries, sir.
Thank you, Honorable Romulo. We now recognize Ms. Marites, Director of the Philippine Chamber of Food Manufacturers.
Good morning, and our chairperson, honorable members of the Committee on Health and Committee on Welfare of Children. On behalf of the President, I am representing the Philippine Chamber of Food Manufacturers, Inc. We represent a broad cross-section of food and beverage manufacturers in the Philippines, and we appreciate the opportunity to participate in today's discussion. Thank you for inviting us as a resource person in the bills being heard today under the proposed Healthy Food Marketing Environment Act. PCFMI supports the government's goal of protecting consumers and improving public health outcomes, including addressing lifestyle diseases and other non-communicable diseases. We want to be part of the solution that work in the real world, not only on papers, and we are committed to partnering with the government in consumer education and practical science-based measure. With that spirit, we share our position in a very straightforward way. We support stronger nutrition information and stronger protection for children, but we respectfully ask the committee to shape this bill so that they are evidence-based, locally relevant and enforceable, and that they do not create unintended consequences for legitimate commerce, jobs, and food access. First, on the sale and marketing restriction, especially those involving children. PCFMI supports strengthening responsible marketing to children, but we strongly believe that the law must be precise and targeted. We recommend a clear definition of children as those under 13 years old. And we ask that the rules clearly distinguish child-directed advertising, which should be restricted from family-oriented communication aimed at parents and providing factual product information. The distinction matters because parents are decision makers and we should not unintentionally block responsible communication to families. We also encourage the committee to treat digital marketing, influencer content, and platform-based advertising realistically, because this is where children actually spend time today. We have proposed strengthening implementation through collaboration with the Advertising Standard Council, with clearer voluntary guidelines, post-marketing audits, and reporting mechanisms, so enforcement is consistent and measurable, not vague and selective. Second, on the front of pack labeling, PCFMI supports the single national FOPL system, aligned with the National Nutrition Policy and food regulations, and implemented with transparency, monitoring, and review. But we also want to be honest about what will make FOPL effective: consumer education and local testing. Available local data show that many Filipinos still don't regularly read nutrition information, and among those who do, only a small proportion look for nutrition facts, so the label design must be something Filipino consumer can understand quickly, and it must be paired with an education program. That's why PCFMI has consistently advocated for phased implementation, a practical, manageable rollout that gives time for consumer education, industry adaptation, and product reformulation where feasible. As to the format, across our submission, PCFMI has proposed workable option ranging from mandatory monochrome GTA, which means guided to a daily amount approach. It should be per-serving, aligned with education, existing FDA labeling practice. To more recent work towards an intuitive, color-based graded approach that is grounded on Filipino dietary pattern and designed to be ASEAN harmonization ready. What is consistent in our position is this: whichever approach is chosen should be science-based, consumer-tested locally, and implementable, including practical exemption for small packages and clear transition rules. Third, on nutrition profiling, particularly, we understand why nutrient profiling matters. It becomes the engine behind labeling triggers and marketing restriction. But because it carries so much weight, we respectfully caution against locking the Philippines into a external model as default without sufficient local validation. PCFMI supports a nutrient profiling system that is nationally approved, transparent, and grounded in Filipino dietary pattern using Philippine data, such as the National Nutrition Survey, and aligned with the Philippine Dietary Guidelines. The goal should be a model that is not only technically sound but also fair across product categories and workable for local manufacturers, including small and medium enterprises. Finally, on the provision frame from food industry interference, we agree that policymaking must protect integrity. At the same time, we respectfully submit that the most practical approach is transparency and managed conflict of interest, rather than blanket exclusion of industry from consultations. If the goal is implementable regulation, especially on labeling, reformulation, marketing standards, and compliance system, the government needs structured, transparent engagement with all stakeholders, including consumer, health professionals, academe, and business. PCFMI has consistently supported this kind of public-private partnership approach. Mr. Chairperson and honorable members, PCFMI is here in good faith. We are not asking Congress to abandon public health protection. We are asking that these bills, including the HB 13, and other related measures be refined so they protect children, empower consumer, and improve health outcomes in a way that is clear, fair, locally grounded, and enforceable. We have submitted written recommendation and is ready to work with the committee and the Department of Health on specific language, particularly the scope of marketing restriction, the design and timeline for FOPL, the nutrient profiling approach, and practical compliance rules. Thank you, Mr. Chair.
Thank you, Attorney Fabul. From the United Nations Children's Fund, we now recognize Ms. Alice and Koroy.
Thank you. Thank you so much, your Honorable Chairperson and distinguished members. Actually, if you can allow me, we are working very closely with the World Health Organization. So if that's okay, my colleague from the World Health Organization can start, and then I will continue afterwards, if that's okay.
Yes, but please make your presentation brief because
Sure.
we have a lot of bills to tackle.
Thank you. Thank you so much. Yeah.
Thank you very much, Honorable Chair and members of the House Committee on Health and Committee on Welfare of Children. Good morning. On behalf of WHO and UNICEF, we'll submit a joint position statement on the pending House bills on a healthy food environment, particularly on front-of-pack labeling and regulation of food marketing to children. Today, my remarks will focus more on front-of-pack labeling, while my colleague in UNICEF will focus on the regulation over food marketing targeting to protect children. So today, from WHO and UNICEF perspective, we welcome the committee's leadership in advancing legislation and make healthier choices easier for Filipino families, specifically for our children. And a well-designed front-of-pack labeling policy can help consumers, especially parents, caregivers, adolescent children, make better informed healthy choices at the point of purchase, and it can also encourage food reformulation over time. So this contributes to improved diets and reduce risk of diet-related non-communicable diseases. And here we have one key question. Will the law establish an front-of-pack labeling system which is understandable, implementable, enforceable, and effective at population level? So therefore, we respectfully offer several practical recommendations for your consideration. First, ensuring broad coverage and consistent application will be critical. Front-of-pack labeling should be implemented in a way that reaches the population and is applied consistently across eligible prepackaged foods and non-alcoholic beverages. Consistency matters to drive public health impact. Second, front-of-pack label should be interpretive and easy to understand, as mentioned by many members of the committee and also earlier the comments. It should provide at-a-glance guidance using simple symbols, colors, and/or words rather than relying on numbers alone. The third point, front-of-pack labeling should be grounded in a government-endorsed nutrient profile model as presented by National Nutrition Council, which is a transparent classification system based on nutrients of public health concerns, especially saturated fats, trans fats, sodium, and sugars. Fourth, front-of-pack labeling should complement, not replace, back-of-pack nutrition information. The nutrition declaration remains essential for detailed information, while the front label supports quick interpretation and easy to understand for the consumers. The fifth, the label should be clear, standardized, consistently placed, and informed by formative research, including consumer testing. As mentioned earlier, there should be local testing to reflect the national and country's context and the situation. The next point is it is important to protect the system from being undermined by misleading claims and promotional packaging techniques. Here, I would like to highlight the front-of-pack labeling should go with strong regulatory system for marketing, food marketing system in the country. The seventh point is the law should require monitoring, evaluation, and periodic review supported by baseline data, which will allow the system and enforcement to be strengthened over time based on the evidence and implementation experiences. A final point, honorable members, is about legislative design. The most appropriate front-of-pack labeling system depends on the country context, should be determined through nationally led process. We would like to recommend the law set the mandate, core principles, and the detailed technical specification can be finalized through the implementing rules and regulations aligned with the National Nutrient Profile Model and informed by consumer testing. In closing, WHO and UNICEF respectfully encourage the committee to incorporate these recommendations so that the resulting front-of-pack labeling policy is credible, practical, and effective in helping improve diets and prevent NCDs. Thank you very much for your consideration. I would like to hand over to UNICEF.
Thank you. Thank you so much. And just before I start I just want to highlight that in response to the question around undernutrition and overweight, for the first time in 2025, overweight has crossed the line over undernutrition. This is globally. In the Philippines, while it has not yet gotten there, but the trend we see is that undernutrition is reducing, which is really good, but overnutrition is increasing. So it's really important for us to focus on that. So from a child rights perspective, I think this discussion is just for us ensuring that every child grows up in an environment that supports healthy growth and development. And I'll just, in the interest of time, I'll focus on 5 key things that relate to guidance from UNICEF and WHO on unhealthy food marketing. First, the legislation should adopt a comprehensive approach to restricting unhealthy food marketing across all environments. This is where children are exposed on television, digital media, schools, and retail environment. Second, the law should explicitly address digital marketing, where children are increasingly spending time. The third, implementation should be supported by a clear and evidence-based nutrient profile system to determine which foods are subject to marketing restriction. Number 4, the law should address marketing techniques that strongly appeal to children, such as use of cartoon characters, celebrities, games, and promotion of giveaways. And number 5, front-of-pack labeling, again, this should be done together, ensuring that an evidence-based front-of-pack nutrition labeling, just like my colleague from WHO mentioned, is actually used as well to strengthen the children's food environment. So, Mr. Speaker, just to mention that this is really around protecting children, harmful marketing to children. It's a child rights issue, at the same time of public health issues. Thank you so much.
Thank you. Yes, Honorable Romulo.
Mr. Chair, just to clarify a few points, because UNICEF mentioned that they mentioned data on the global crossing of obesity already. But they said in the Philippines, it has not quite reached that. So the question I have for UNICEF is that, do they have a study? Do they have research? Do they have numbers specifically only for the Philippines and the ages, in particular ages?
Mr. Yuli?
Yes.
Dr. Yuli? Or either of you?
Yes. No, what we have, maybe just to step back a little bit, when we talk about undernutrition, child undernutrition, we look at wasting, stunting together. For wasting is higher than overweight. We use the same indicator. If you look at wasting today...
Yes, we understand that. You already stated that earlier. The question is specifically this. Do you have a study specific to the Philippines? Really, with the real numbers of how many are undernourished, what ages, and how many are obese, and what ages are these?
Yes,
Do you have that?
This data is available from the Food and Nutrition Research Institute. So we've done further analysis of that
So it's
data.
Not yours. It's not your own.
But what I can say...
That is by the FNRI.
Yes.
So you have relied on the data that was already given by FNRI. That's correct. Yes.
To analyze. Yes.
And based on that, you now come to this conclusion that you support the various bills.
Absolutely, we support the bills.
Yes.
Yeah.
Did you also make any study in the Philippines? Because unlike the global stage, the Philippines is still a third world country. And in the Philippines, there are really many families still at the poverty threshold. And when they are at that poverty threshold, really the affordability matters. And have you already made a study whether all goods, all foods are there foods available even to those who belong to the poverty threshold? Have you made a study on this?
We've done a couple of studies.
Yes, could you submit that to this committee?
Yes, we will submit
Yes,
those.
what year was this study done?
We have from 2021, we have from 2023, 24, and 25.
Yes, that covers the
Actually,
whole Philippines, or did you pilot it any particular place?
we did samples. One of the latest that we have actually was done by young people themselves. But there's a series
Does
of
it
studies.
matter if it's done
No,
by young people?
it's actually good that it was done by young people because they also provide it.
I think it's more important it was done by professionals.
Absolutely, absolutely. It was done by professionals.
Yes.
So we basically what I'm trying to explain
Yes.
is we have a range of studies. We have studies
Yes.
that sort of strengthen the case. Some of them done by UNICEF ourselves, professionals, as well as studies coming from young people also, kind of qualitative information. So what we can do...
FGDs, you mean FGDs?
Sorry, FGDs, absolutely,
Yes,
that was
okay.
done.
All right.
So what I will do is, as we submit our joint
Yes.
position paper, we will submit all of these
Yeah,
studies to you for
yes.
your
Because
reference.
if you notice, there were also statements earlier that when we pass this, it must be evidence-based.
Absolutely,
And part
yeah.
of the evidence-based would really be, you know, when you pass this, it's also affordability.
Yes.
Because is this measure going to be treated as anti-poor
Yeah.
if there's nothing going to be affordable for those in the belong to the poverty families in the poverty threshold?
Yeah.
Thank you. Thank you,
Thank
Mr.
you.
Chair.
Thank you, Honorable Romulo. Before we proceed, we'd like to acknowledge the presence of committee member, Honorable Agustina Dominique Pancho of the 2nd District of Bulacan, and Honorable Elijah Rumbawa San Fernando of the Kamangagawa party list. For the information of everyone, we have around 10 more resource persons, but I don't think we can accommodate the other resource person. So the co-chair Singson and I decided to suspend for now the meeting, and then we will be announcing the date of the next meeting on healthy food bills. I'd also like to acknowledge the presence of Honorable Carlos Andes Loria, Vice Chair of the 2nd District of Albay. Honorable Maceda.
We move to suspend the joint meeting.
So there's a motion to suspend the joint committee meeting, and the date of the next meeting will be announced in the next few days. So for the resource persons for the joint committee meeting, you may now be excused. In 5 minutes, we will resume. We will now commence with the regular meeting of the Committee on Health.